So today, folks, I am going to do the thing that all healthcare providers tend to do and tell you to stop smoking. But I'm going to give you a pretty darn good reason besides just, it's going to cause cancer and Anyway, so trans feminine people on estrogen therapy, please listen up. I'm not going to throw, it's going to cause more blood clot risk and No, I mean, while that is still of concern and you should consider it, consider this. You really need to quit smoking because of how nicotine affects estrogen in your body and its receptors and whatnot. So there are studies out there on, premenopausal cisgender women, menopausal cisgender women, rats, all sorts of things on how nicotine affects estrogen and how it interacts with its receptors and things in the body. So there is a lot to it, and I don't want to make this video super long and super boring. I just want to get my point across that, especially if you're struggling with your transition or you're wondering, what am I doing wrong? It could be nicotine, because even a very small amount of nicotine, just 1 or 2 cigarettes, or vapes, it's vapes too, anything, nicotine-wise, can cause some impaired interaction with estrogen in your body. So not only does it, kind of screw up how it could interact with receptors, but mainly what it's going to be doing in there is affecting how estrogen is processed and metabolized and converted in your body. Most especially, it's been shown with estrogen tablets, so oral estrogen. And this is because of how it goes through the first pass of the liver and yada yada. But it especially affects that type of estrogen in that it increases how fast your body metabolizes it, so that you're essentially like putting it in and shooting it out, and you get very minimal effects from it transition-wise, and other benefits-wise, such as, helping prevent osteoporosis over time. It's kind of not great for that because it's going to inactivate it. So nicotine has been shown to cause increased hydroxylation of estradiol in the body. It also decreases the body's ability to use aromatase, which is what is going to help convert testosterone into estradiol. It's going to prevent estrone, a different type of estrogen, from being able to go back into estradiol. Anyway, so it's really messing up with your metabolic pathways and your pathways of, creating these different hormones for use in the body, and then it increases the rate at which you are eliminating them from the body. And so, don't think you're safe if you are, on transdermal estrogen, which would be like patches or creams or something, or injectable estrogens. These are susceptible to this too. While I mentioned that pills tend to be heavily affected by nicotine because of the first pass through the liver effect, that doesn't mean that these other forms of estrogen are not affected by nicotine, okay? So they too can be essentially, I'll call it deactivated, in the body, so that they are not able to interact in a significant way with your estrogen receptors, and then they are also eliminated a little bit more quickly. So yeah, just putting this out there because I know, everybody's got their vice, whether it's cake for me, because I be loving those sweets, or whether you are smoking or vaping or whatnot. Maybe think about your transition next time before you light up a cigarette or do a vape. See if you could decrease the amount of nicotine even if you're not planning on stopping altogether, because smoking, of course, is going to increase your risk for blood clots and or all the other things that everybody in healthcare is always throwing at you if you're a smoker. But maybe this will be the thing that gets you to quit. Because I'm finding that whenever I mention this to patients, they're completely unaware. They haven't heard this before, or they kind of sort of heard it and they were just like, But it actually is a pretty significant effect. It's nothing to sneeze at, so to speak. So think about it, okay? And decrease or stop smoking and or vaping or whatever your way of getting nicotine in the body is. Decrease it. Okay. Have a great day. Bye.